February is Children's Dental Health Month, and from baby teeth to brushing, Dr. Bobby Garafalis is here from Hampton Roads Pediatric Dentistry to answer parents' most frequently asked questions. Welcome, doctor. How are you?
I'm great. Great job with my name, by the way.
Thank you. I was practicing it all morning.
Exactly.
Okay, so I have a question. So, like when baby gets their first little tooth, and you're all excited as a parent, they got their tooth. Do you have to brush that one?
You have to keep it clean, obviously, because they're still feeding. You know, you're going to accumulate plaque, maybe tartar, so you do want to still clean it. I don't recommend whacking at it with the brush all the time, but you know, something as simple as these tooth and gum wipes work really well. And honestly, if you don't have this, even a warm wet washcloth just to wipe the teeth down work really well for babies.
Okay, and as they get to having more teeth, how important are baby teeth?
They're very important. They're important for function. They're important for guiding space for when the new teeth come in. Aesthetically, you want to have nice teeth with your pretty child. So, I mean, they're very, very important. Okay,
and so what are some of the techniques that you use to get kids to brush? Because I know, you know, you had to do the ABCs, to tell them to brush through the whole ABCs, but some of them don't get it after they go through that, phase.
Well, you know, we still recommend for parents to take ownership of it when they're really little, you know, from when they're 1.5 till about 3 or 4. And something like a small brush like this that'll help kind of, you know, keep all the molars clean when they come in. Keep everything clean as well. As they get older, let the child take responsibility, but you still, as a parent, have to guide them and kind of still look at them and make sure that they're doing it properly, not swallowing the toothpaste if they're doing fluoride toothpaste, or if you're worried about that, having something like this training toothpaste that does not have fluoride in it works really well as well.
Okay. As we get older, you know, we try to keep our kids away from sugary things and the stuff that sticks in their teeth, but are there ways to prevent cavities?
Honestly, just good old-fashioned brushing and flossing. And flossing is really important. A lot of parents come to my practice and they're like, I didn't know I have to floss baby teeth.
Oh,
so if they have spacing, which we like with baby teeth, then obviously a brush will get in there. A lot of times, though, the back molars do not have spacing. They become easy plaque traps, which can lead to cavities. So you have to start flossing those molars as soon as they start coming in, or if the front teeth are very tight, you have to floss.
I didn't know that. Now my kid's 14. What?
And they're not flossing.
I didn't floss them as a baby. Oh, no. Okay.
Well, if they didn't have cavities, they're lucky. But, you know, not every child is different. They inherit different, you know, enamel and whatnot, or they're more prone to cavities genetically. So you need a floss. Okay.
Are you a proponent of sealing teeth or not?
Absolutely. I think definitely, you know, sealing, especially the permanent first molars as they come in, because a lot of times 6- and 7-year-olds don't go all the way further back, so it's a good way to kind of help prevent cavities on those new teeth coming in.
Okay, and you have this little animal. Tell me about him.
So this is Sparky. We have this at our practices, and we just help kids, you know, show them with our assistants how to brush. And a lot of kids kind of just do this.
Right.
They're not getting the gum lines.
You got to do the swirl.
You got to do the swirl for 2 minutes. I mean, you're swirling up and down. You're getting the gums. The gums are very important to keep clean as well. And a lot of times for parents, they don't realize they need to kind of brush behind. We all get tartar built up back here, even kids, so when you're brushing you have to angle that brush and kind of get behind there as well. So it's a very good technique. We have these at our offices, and we'll let the kids play with them, and they're very great educational tools for our youngest patients.
Okay, and so when do you suggest that little kids start brushing their own teeth?
Every child is different. So I have some kids that they're 3 years old and they want to do it by themselves. So if they think they can do it, they can. But again, a parent should supervise them, honestly, up until they're about 6 or 7 years old to make sure that they're doing it properly.
And is there a particular time when kids should start losing all of their baby teeth? Is there a time when it's like you should not have any more baby teeth?
So usually the average is they lose them all by 12.
Okay.
Everyone's different. My son lost all his by 10. I saw a 13-year-old yesterday with about 6 baby teeth left.
So what do? You kind of pull them all, or what?
Not necessarily. If they're coming in fine, we're good with it. If they need to see the orthodontist and they want things to move along quicker, then they might recommend us to help them out. But again, each child in each case is different. So if they're still there at 13 not causing a problem, then we just leave them in and let nature take its course.
Okay, and doctor, where do we find you?
You can find me at several locations. I usually work out of the Newport News office, Hampton, Williamsburg, Gloucester, Yorktown, and then we do have a couple locations on the south side as well.
And if you reach out to hrpddentistry.com, you can find you at any of those locations.
Yep, just ask for Dr. Bobby. My associates are great as well. We're a great company, and you know, we're a great asset to the health community here in Hampton Roads.
Great. Thank you so much for explaining all this.
Thanks for having me, April. Again, it's great seeing you.
You too.